Hi everyone. Many people asked about business case establishing a nurse-led clinic and patient leaflets. So, for the purpose of part one exam, business case is not something that will appear in part one exam. It is a plus minus question in FRC part two exam. So, I will not discuss a business case for part one candidates. I may discuss it for FRC part two candidates in the future session. The next one is nurse-led clinic and patient leaflets. Yes, they are important topics. They have appeared before in the FRC part one exam. They can appear again. Now, the nurse-led clinic can be about any hematological disease. It can be CLL, CML, hemochromatosis clinic, sickle cell, thalassemia, uh, those which are stable disease and in which we have to monitor the patient for a few years after uh, achieving remission. So nurse-led clinics in our trust are for CLL, for sickle cells, for CML, hemochromatosis, and many other diseases. So the questions are usually two: what are the steps in establishing a nurse-led clinic, and secondly, what are its purpose or benefits of a nurse-led clinic? So to establish the a nurse-led clinic, the basic 10 to 12 steps are that first, build a business case, which means explain why the service is needed and what are the aims and objectives. Second is the aims and objectives. Clearly explain what are you offering to the patient and to the other professionals as well. Third is the criteria. Which patients can be referred to this clinic. Fourth is services. Which service you will provide to the patient? Is it phlebotomy only, or phlebotomy plus sections, or um, patient symptoms review, etc. Team members is the fifth component. Who will be the team member? Do you need nursing staff, uh, or would you need phlebotomy staff as well, or venesection staff as well, or you want to involve lab in this process as well, or not? Then staffing issues. Do you have enough staff to run this clinic? What are the staffing arrangement to run this clinic smoothly? Seventh thing is the publicity. Um, Advertise this clinic on the trust intranet, in the poster form, or by sending an emails to the relevant specialty. For example, if the clinic is about MDS, then you have to send email to hematology registrars, SHOs, and myeloid consultants and transfusion consultants. If the clinic is about hemoglobinopathy, then you need transfusion consultants, red cell clinic, red cell consultants, and hematology registrar, depending upon the target doctors involved in running this clinic. Then location, whether inside hospital or off-site, which means somewhere else. We have many trusts here in UK where hospital is based at one place and their outpatient department is a mile away or 2 mile away in another place. Their outpatient department is set up there and the inpatients are seen in the hospital. So location matters, which is affordable and approachable to the patients. Then a multidisciplinary team um, need to be informed about that this clinic so that they can refer the patient to your service and they can decrease the work burden on the consultants and registrar. Then professional development. The staff involved in running this clinic, the CNS staff or the nursing staff, their competencies assessments, how regularly they will be assessed, and what will be the criteria for that. You need to explain in your request form, as well, when you are building a business case. Audit and evaluations. Um, it can be 6 monthly, it can be yearly, to see how many patients you have seen. Uh, you can present patient feedback or survey in that as well, to see whether you are achieving your aims and objectives or not. It is giving any benefit to the patients, hospital, or not. Um, that you will find out through audit purpose. Then the last one is improvement. Um, Improvement depends on your findings of audit. Um, if you think that there is something which can be done to improve the service, you will come to know from the audit, and you can implement that on trial and see basis, and re-audit it in the future to find out whether your proposals has worked or not. So these are the 12 points in establishing any clinic. I will enumerate them again. First of all, build a business case. Business case would include a lot of things, which are, first of all, aims and objectives, criteria of the patients, what services you will provide to the patient, team members, staffing issues, publicity of the clinic, location of the clinic, support from other colleagues or multidisciplinary team, professional development of the staff involved, audit of the services, and improvement in services. So these are the um, uh, 12 basic steps that you have to apply in establishing any sort of a clinic. It can be a hemoglobinopathy clinic, it can be a chronic leukemias clinic, or it can be any follow-up clinic. Then the next question can be that what are the benefit of nurse-led clinic? So the benefit of the nurse-led clinic are for the patient and um, for the practice team or clinical team as well. As far as um, I have seen the feedback from the patient in my practice and in my trust is that patients are much satisfied with the nurse-led clinic because their symptoms or their concerns are addressed quickly rather than waiting long for the doctor. And by this addressing the concern and symptoms, their quality of life is okay. The outcomes of their concerns are very positive. And in terms of the clinical team, there is less burden on the clinical team, and the clinical team can address the new referrals very quickly. And um, um and also the nurse-led clinic gave an opportunity to the nursing staff as well to learn more about the disease and address the patient concerns very efficiently without involving the clinical team in every case. So you can write something about benefits for the patient and benefits for the clinical team if it is asked, and I'm sure it will be asked in the question in the FRCPAT exam if this question come up in the paper. Next time we will discuss a few things about patient leaflet. It can be about anything. It can be about hemoglobinopathy. It can be about lymphoma, leukemia, transplant, CAR-T, bispecific. Anything can be a patient leaflet. So we will discuss that in the next video. But um, I'm hoping to give a scenario about that so that we can discuss the answers written by the candidates in the FRCPAT Part 1 group session.